just creates anxiety, which is not helpful to anyone. At the same time, I would also want to add that this is a time of compassion. For me and most of you, I think this is the first time we have seen this in our lifetime, this kind of pandemic, which has put us in a sort of social isolation, I would say, and so much is going on around us. Being in a food business, that's my job. So I think this is the best time to show our compassion and our in bulk at the same can keep up the and Dr. Nausheen will be I think, and I have Nausheen with me who will go is associated with this time and how to handle them. Again, if you have any questions, start putting them in our comment box or email it to me, health-wellness@darulnoor.org. And inshallah, even if you don't have any questions right now and something comes up into your mind later on, you can always email us or reach us through the Masjid Social Welfare website or my email that I mentioned again and again. Social distancing issue. We are coming one by one. And start her part. So please bear with us. Keep watching.
Assalamu alaikum. I'm Dr. Hina Khan. I'm the medical director at PM Pediatric Surgeon Care. This is our session today. I'll start with a quick recap of what we had talked about last time. And just quickly, we're dealing with COVID-19 virus, which comes from a family of coronavirus. It's a relatively new virus to us. We do not have any vaccines for it and it as well. It is spread through droplet infection, which means if someone is infected, it's up to a distance of 6 feet, and if they land on you or on other hard surfaces, that's a means of getting the virus as well. It is spreading rapidly. In Virginia, as early as this morning, there were 391 cases, and there were 32 in Prince William County. I'm fairly certain that the numbers have changed since then as well. It can cause severe respiratory and may require people to get more supportive care in hospitals under ICU conditions as well. So I did have a couple of questions from our last session, so I'm going to go over quickly over some of those. So the first one was, what are the symptoms? What if someone is concerned about having COVID-19 or showing mild symptoms, and what should they do and how do they get tested? So symptoms of being infected with COVID-19 can vary from mild, like cold, fever, cough, which majority of the individuals will get, and can go to severe symptoms like nausea, chest pain, shortness of breath, and difficulty breathing. So if you think you have developed symptoms of COVID-19 virus, you have mild symptoms, what should you do? The first thing you should do is do not panic. Do not rush yourself to the ER. You are in greater danger of getting things from the ER, getting more infected there than actually from your own home. So you need to stay put, call your primary care doctor or call the local health department. A lot of primary care doctors are doing telephone visits and online visits. They will evaluate you, they will assess your risk factors, and then they can decide whether you need COVID-19 testing or not. There are a lot of drive-through testing centers now in Virginia. Some urgent cares are doing the testing as well. Again, they will evaluate you first, and then they will decide if they need to do the testing. The results, if they're doing a if your condition is worsening, one of me about it. So social distancing. I get this question a lot. You might not be sick. Your relative may not be sick either, but we do not know if we have the virus or not. Just to take and have the virus. And then you meet up with them and they transfer the virus. Dinners, no socializing at this point. It's very boring to stay at home. It feels like we're not really doing anything. We're not contributing to anything, but you need to. And if you do develop and wear them, they might give you a false security that you might still go out, wearing the mask, thinking everything is okay, but you're still spreading the virus or are at risk of catching the virus. And so those were our next.
Assalamualaikum. My name's Nasheen Yunus. I'm a licensed clinical psychologist in private practice in Woodbridge. And I just wanted to share a few quick kind of coping skills, coping mechanisms that we could all use during this time of. And so hopefully you can benefit from the couple of tips I have to share. So first of all, I just want to highlight that we are all going through this as collectively, the human race is all going through this, whether that be just the anxiety of getting virus, the anxiety of your loved one getting the virus, the financial stress a lot of people are dealing with in terms of like being laid off or just being let go from jobs. There's the social isolation with the social distancing that people are dealing with, the increased loneliness, the boredom, and just not feeling productive and just being thrown off of our daily routines. And then just a general uncertainty over this has never happened in most of our lifetimes. So I think just it's a natural human response to have all of these different sets of emotions. So in terms of coping with that, the first step is to normalize those feelings. So given the current situation, anxiety, loneliness, fear, those are all totally normal human reactions. And that is the first step and the most important one in handling the feelings, because there's nothing that anybody can do to avoid feeling some kind of mental distress in response to something like this. So that's the first thing, to normalize it and to not really push it away. And a lot of times we try to distract ourselves by like looking at the news and giving us a sense of control from thinking that like, oh, we just need to know more details. And that sometimes can help, but a lot of times it makes our anxiety even worse, because we're just being inundated with all of the facts all of the time. And so a coping skill in that kind of dealing with the anxiety is to limit the media exposure. Another thing, and this is a pretty common tip that you may have heard in terms of like coping, but I think it's so crucial with maintaining a daily routine, maintaining the structure, even if you're working from home or not working at all, waking up at the same time, getting ready as if you're going to go to work, and just keeping that as normal as possible, and then exercising, like drinking enough water, sleep, that sort of thing. But I also wanted to highlight some other things that we might not be thinking about that readily. But just that with the term social distancing, although we have to obviously maintain that, kind of not thinking of it as much as social distancing versus like physical distancing, because we can definitely maintain our social connections and even use this as an opportunity to grow those social connections by picking up the phone and calling a family member or a friend that you haven't spoken to in years, and this being an opportunity to connect with those people that maybe we've lost connection with, and then using things like Zoom and FaceTime to kind of keep that contact. Another really good way to sort of cope with dealing with the intense emotions that come with it is a phrase that comes from the mindfulness practice, kind of an abstract thing, but we call it name it to tame it. So just by labeling the emotion that you're feeling, whether it be fear, anxiety, sadness, despair, hopelessness, that oftentimes helps to soften it a little bit. So doing, like, whenever you're feeling a distressful emotion, to just stop for a second, pause, try to practice not pushing it away, but label it and kind of get curious as opposed to resisting the feeling. Because again, like, we're all going through some level of discomfort related to this. So instead of pushing it away, kind of embracing that as part of the collective human experience. And then also thinking about ways that you can help out and can be productive, because part of what people are experiencing is they're not feeling like they can contribute or be a productive member of society. So thinking of ways that you can give back, whether that be like if you have a neighbor who is in quarantine and is more of in the high risk population, offering to get groceries for them, or just offering your time to people through remote ways, or financially donating if you can to organizations that are meaningful to you. And then aside from that, if you have insurance or you have the capability, seeking out mental health support through a therapist. A lot of the therapists in private practice are switching to doing telehealth because of the whole crisis. So there are still resources. A lot of the physical offices are closed, but people are still offering that support. And also the organization, the National Alliance on Mental Illness, www.nami.org, has a lot of resources in terms of organizations that you can use for free crisis support, disaster relief support, and they just have a wealth of resources. So that's a really good one that I wanted to put out there. But yeah, just some real quick tips. And we have too much time, but inshallah, if you have any other questions, like Stara Asma said at the beginning, feel free to ask, and inshallah we're all going through this together. Assalamu alaikum.
Hesitate to ask, email us, leave a comment wherever it's easy. Inshallah, we will all come out of it. We will come out of it as a stronger and a better person and a community. Inshallah, take this time as an opportunity to reflect on a lot of things that otherwise we didn't have time for. Start a new hobby, start reading a new book, whatever makes you happy or satisfied, just attach to that as make a stronger person and a stronger community. So good night, everyone. Inshallah, we will be live again next week sometime. I'm not exactly sure which day, depending upon the availability of our doctors. But inshallah, we will be live again next week. And if you have any concerns, anything meanwhile, email us, health-wellness